Hello everyone, this is Venkatesh, your host for the podcast Leading Self and Others. Today, in this episode, we have another inspiring and interesting guest with us. She is a licensed psychologist who completed her PhD and research associateship from the University of Delhi. She is the founding member and working as a senior consultant psychologist in Heart to Mind Psychological Services. She has published about 20 articles, research papers in national and international peer reviewed journals, chapters in books, book reviews, and including a book called Cognitive Behavioral Intervention in Controlling Conduct Disorder. She has been associated with several delinquency homes, prisons, sexual assault victims, and with different communities. She has more than 18 years of experience in the field of research, teaching, and as a psychologist. So let us welcome Dr. Pubalin Dash.
Hello, everyone, and welcome to Leading Self and Others podcast, a podcast exclusively based on how you can effectively lead your life and the people around you, anywhere, any place. Every week, you'll be provided with some nourishing dose of thought-provoking and influential messages. Here is your host, Venkatesh, human resources professional, leadership speaker, and author of 2 acclaimed books, Rise to Lead You and You and Your World.
Yes, good evening, Dr. Pubalin. I hope I am pronouncing your name rightly.
Yes.
Great. Thank you for joining this podcast. And for this audience purpose, I would like to know from you about your profile in a brief, please.
Thank you so much for inviting me here. It's my pleasure to be a part of this podcast. I'm Dr. Pubalin. I am a consultant psychologist, and since 18 years, I'm into this field only. I have, I have experience working with, prisoners and sexual assault victims. And right now we are having a company called Heart to Mind, where we are providing counseling to, the corona victims. And apart from this, we are associated with other lot of works, which is basically the basic focus is mental health. So that is what we are working on.
Okay, you are basically from which part of India?
I'm from Odisha, but we are settled down in Noida, UP.
Okay. So how about your practices right from Assam, or it's only from Noida you began your medical or psychological journey?
No, we are working all over India. In fact, we have just started the corporate training also. So some are from Odisha and some are from Gujarat, Mumbai, and Delhi and Noida.
Okay, great. So as I come to know already about you, that your works more revolving around mental health, and mental health is a topic that is being talked a lot nowadays across various social media platforms, trainers, coaches, books, and particularly post-COVID, we have been talking a lot about it. But to reassure, according to you, what is mental health?
Venkatesh, mental health is a very wide, concept, but it's a state of well-being in which the person realizes his or her own abilities, can cope with the normal stresses or issues of life, right? And the person can work productively and fruitfully, and is able to make a contribution to his or her own people and society. So, mental health includes our emotion, psychological and social well-being. It's a combination of tree of all this. And it affects how we think and feel and act as we cope with life, right? It also helps determine how we handle stress or anxiety, relate to others, and make choices out of that. Mental health is important at every stage of life, from childhood, adolescence, through adulthood and aging. So mental illness are associated with you can say distress or problems functioning in social work or family activities. So it somehow does not discriminate. It can affect anyone regardless of your age, gender, which community you belong to, your income, social status, ethnicity, so sexual orientation, and you can say background or other aspect of cultural identity. But while mental illness can occur at any sort of age, 3/4 of all mental illness begins at the age of 20 to 24. So many people who have a mental illness or difficulties do not want to talk about it, but somehow mental health is nothing to be ashamed of. It is a medical condition, just like heart disease or you can say diabetes, blood pressure. And mental health conditions are treatable also. We are continuously expanding our understanding of how the human brain works, and treatments are available to help people successfully manage mental health conditions. So this is called mental health, but then individually it's a different concept for each individual. Yeah.
Okay, it's quite insightful. And I work on spirituality factor as well. When I say about spirituality, coming back to yourself, your root, that's how I see it as. I don't mix it with any religious stuff. Okay. Likewise, what you have been saying is about mental health. I can think that coming back to normalcy, right? In short,
Right.
that's what I understand. So
It's not exactly normal, but yes, it's like we cope up with the situation.
Okay, yeah. Yes, obviously we have been labeled, or we are judging ourselves when we have some mental illness, right? Yes, whether the society is being perceiving it as wrong or not, we ourselves perceiving it as something, a crime or a sin. So we do not open it up with others. So it's quite good to know from you that. So you have been a qualified doctor. Although you are a doctor, you are also another human, right? So let us know your journey of when did you know or when did you realize the importance of mental health from your own personal experience, please?
Venkatesh, I need to correct you here that I'm not a doctor but a psychologist, or you can say a mental health professional, right? So long year back, when I I went to a metro city in India where I was doing my PhD or my research work. At the same time, I was associated with an NGO who was working with sexual assault victims. And that time, it was a new term for me. Then I can remember the very first day I went to visit a 4-year girl who was brutally raped by her neighbor. And she was in the hospital. The way she narrated her story, still I remember her smile with that so-called fear, right? And for her, how traumatic, I don't know, but for me it was a nightmare. You can't trust, you can believe that the whole night I did not sleep. At that night, the whole night I was thinking of her, because it was very very, very inhuman. She was, the way she was narrating the things, the way the family was traumatized, it was very heavy for me. Then after that, what happened, I worked there for 3-4 years just to understand the feelings of people.
I understand.
Though they are very small kids, and I have gone through a lot of victims in different cities. So after that, I went to work with a opposite aspect, that is a prison, where I saw people with many crimes, murder, rape, different crimes, which was a new exposure for me. I tried my best to understand people's mindset. What I understood from these, that these people are belong to us only. Like we are the people who is doing these crimes and this rape, doing this murder, and and we are the victims as well. Like we have to understand the pain, emotional trauma, and the psychological turmoil in that cases. So somehow now I have been associated with corporate people, where people are in again in post-traumatic stress disorder, distress, heavy stressful life, and don't know how to lead their life. And suicide is very common. In fact, a neighbor, he committed suicide in 5 years back. So somehow I was in academics, and suddenly it strikes to my mind that I have to work for people, because people are coming to us and requesting that just to listen us. No one is there to listen them in the family or neighbor, see the condition of life. So what happened, like after all these experiences, I thought I have to work for one-to-one connection with people. So these areas somehow exposed me to the real world challenges in finding access to care, where I could take a loved one in a mental health crisis, right, and then create awareness to the grassroots level, where no one knows about mental health. So we are creating this awareness through our experiences. So when I made the decision to become a mental health provider, I thought I would feel better, apart from that academics and other things. So I thought I would feel like I'm contributing to the cause on a more personal level, like I could directly connect to the people. So I was interacting with community who expressed their desperate need for help. So we have been working for years to create a place where individual and family will be able to come and seek treatment as you can say a low cost, while also providing an opportunity for their students counseling and exposure for students as well. So this is how I started my journey as a psychologist. It's not audible.
Sorry. I think you are motivated by someone else's pain, right?
Yeah, you can say it.
Yeah, that's a leader's quality. I appreciate it.
Thank you.
Yeah, since you have been treating or counseling your victims or patients, in your experience, what are the commonly seen signs of such mental illness or issues? Because it is not quite easier for ourselves to identify our own issues sometimes. Our behaviors are rightly pointed out by others than we our own selves. So, according to you, what are the signs that we can identify from ourselves?
Right. And mental health, it determines how we think, how we feel, and how we act, right? So good mental health is when you feel positive about yourself and cope well with the everyday pressure, right? If you experience issues dealing with everyday problem, it could be a sign of mental health problem, and should be addressed immediately. So there are a range of mental health conditions a person can suffer from, like anxiety, depression, borderline personality disorder, stress, obsessive compulsive problem, and post-traumatic stress disorder, schizophrenia. So a lot of issues are there. But the early there are some early warning signs that you should be aware of, that can suggest something may be harming your mental health. This can be one or number of behaviors, such as mood swing, regular mood swings, or constantly feeling low. It's very common these days, and I can sense, a lot of people are coming with such issues. Lack of care for personal appearance or personal responsibilities, increased use of addiction like alcohol, drugs, games, or any sort of addiction, thinking life is not worth living, losing interest in different things you used to enjoy before, withdrawing from social activities, and spending less time with friends and family, disturbed sleep, either not getting enough sleep or too much of sleeping, eating less than normal or overeating, perhaps losing or gaining weight as well, feeling irritable. Sometimes people are oversensitive or aggressive, or anger would be there. So having difficulty, concentrating or remembering things. Then experiencing recurring physical symptoms such as pain in the body and unexplained illnesses, a drop in work performance, the person, he's excellent in the work front, but suddenly it's dropped, doing things that do not make any sense to others, and hearing or seeing things that no one else can hear or see. So if you can relate to any of these warning signs, it is important that you seek help. Talk to a friend, talk to a family members, and speak to your close people about any support services available to you, so they can understand what you are going through, and they can work on this.
Wow.
Or you can take the professional help as well.
Wow. But I have been overeating for several years. So is that a sign?
This is something very different.
I understand. Yeah.
Yeah, right.
Great. And if you are finding someone else, not just yourself, if you are finding someone else with these kind of symptoms, how do we approach ourselves to help that person? It is not about me now, it is about the other person, be it is my family member or my friend or my spouse or my colleague is expressing such symptoms, and their behavior is quite abnormal while comparing with their usual. So how do we as a caring person, okay, how do we help them or support them?
Definitely. We need to support people who is having such kind of issues. There are many different things you can do to improve their mental health. First of all, you have to listen them. To be very patient, and you have to listen what's going on without judging them, without saying anything negative to them, without any any opinion. You have to listen them. Second, let them stay positive. It's very important. Try to have a positive outlook. Some ways to do finding balance between positive and negative emotions. Staying positive does not mean that you never feel negative emotions such as sadness or anger, right? In general, we have all these tendencies, as you told, like I'm eating so much. So you need to feel them so that you can move through difficult situations. They can help you to respond to a problem. But you don't want those emotions to take over, right? For example, it's not helpful to keep thinking about bad things that happened in the past, or worry too much about the future, right? So you have to draw a line, what is positive thoughts and what is negative thoughts. You have to make them understand these things, trying to hold on to positive emotions when you have them, right? Taking a break from negative informations, like you can see news and everything. Know when to stop watching or reading the news. Use social media to reach out for support or feel connected to others, but be careful. Don't fall for rumors, get into arguments, or negatively compare your life to others. So somehow you make them understand and stop doing all this, like seeing news or negative news. Then let them know ki, practice gratitude, which means being thankful for the good things in your life. It's helpful to do every day, either by thinking about what you are, grateful for, or writing it down in a journal. Or this can be big things such as support you have from loved one, or little things such as enjoying a nice meal, or it important to allow yourself a moment to enjoy that you had the positive experiences. And practicing gratitude can help you to see your life very differently. So and another way is taking care of your physical health as well, like being physically active. Exercise can reduce feelings of stress, anxiety, depression, and improve your mood. Getting enough sleep, if the person is not sleeping properly, sleep affects your mood, you know that. So if you don't get a good sleep, you may become more easily annoyed and angry. Over the long term, a lack of quality sleep can make you more likely to become depressed. So it's important to make sure that you have a regular sleep schedule, that get enough quality of sleep. Then healthy eating is also very much important to make them understand you have to proper food. Then the main thing is that connecting to others, like connecting with other people. Like humans are social creature, and it's important to have strong healthy relationships with others. Having good social support may help protect you against the harms or stress. So it is also good to have different types of connections. Beside connecting with your family, friends, you could find ways to involve in different, community or neighbor. Then developing a sense of meaning and purpose of life, they make them understand to feel that, what is your purpose of life and how you are, giving a meaning to that. Then coping skills, let them develop their coping, so which are the methods you see in deal with stressful situations. And then meditation is one way, relaxation technique is another way, or different types of relaxation techniques are there. You do to produce your body natural relaxation responses. They slow down your breathing, and lower your blood pressure and reduce muscle tension and stress. So this is one thing they can do. Deep breathing exercises. It's also important to recognize when you need to get help. Talk, a counselor, or a very close friend of you, where you can share your things. And in severe cases, you need medications.
That's wonderful. And I understand that it not only for the persons who have that mental disturbances have to be courage enough to open up with others. The
Right.
persons who wants to support the other person should also have such amount of courage. And but it's quite sensitive matter. They have to be careful on how they are handling.
Yes, and they can, even understand these small things. These are very, very common things which we can use in our daily life. Everyone can use it. So that is, let them understand how they can cope up with the situation. It's very difficult to explain your feelings to somebody, but you have to.
True. And one final question. It is my usual question, but a surprise question I would ask. And what is that one question you would like me to ask you? And what would be your answer for that?
Okay. Now, you can,
You can tell something what that you want to tell for
I
this world.
like to say something about the reality of mental health, the recovery process. Okay, people can add to do recover from mental health problems. Recovery can be a process rather than a particular outcome. So this process does not always mean getting back to where you were before, right? So it will have some ups and downs. So it requires commitment from you and support from your family and friends. Then it can allow you to lead a normal life. It will involve finding your own ways to coping with life's challenges. So for many people, recovery is about staying in control of their life despite experiencing, you can say, mental health problems, right? So, self-direction is required. There are few tips I just would like to, tell here, where a normal person can practice in their life, like journaling, or you can say the diary writing, right? As we before remember our past, many times you might have kept a diary hidden under your mattress or your cupboard. It was a place to confess your struggle and fear without judgment or you can say punishment, right? So it likely felt good to see get all those thoughts and feelings out of your head and down on paper. So it's clear the way you feel or think without any judgment. So that's why we try to write down in journals, right? So you may have stopped using diary once you reached to that level where you don't feel to write anything, but the concept and its benefits still apply. Now it's called journal writing or diary writing. It's simple writing down your thoughts and feelings to understand them more clearly. And if you struggle with stress, depression or anxiety, keeping a journal or diary, it can be a great idea. It can help you gain control of your own emotions and improve your mental health. And second, relax, meditate each day, read something new and interesting make a routine of this. You can pursue your old hobby and you can learn something new to enhance yourself. Talk to old and young people, just to be there for them. Exercise regularly. It may be any form like Zumba, dance or anything. Treat yourself to very special and pamper yourself sometimes. It's very much required. Stay away from any addiction. It may be game, it may be alcohol, it may be drugs, anything. Like, stay away from these things. So that is my request to all of you.
Yeah, thank you so much for this quite insightful speech from you. I'm sure many would find helpful from what you have been saying for this past 30 minutes. At least me would use this for sure. You have been not just talking to the people here, you are talking to me directly and to my issues as well. Thank you so much for joining with us, and it's quite pleasure to have you in this podcast, and definitely this podcast will be much helpful to the audience who are listening to us. Thank you.
Thank you, Venkatesh. Thank you for inviting me in this podcast. Thank you so much.
Last but never the end, buckle up to get inspired and more realistic thoughts from Venkatesh. Make sure to subscribe now, just so you don't miss any episode. If you think this podcast has inspired you and may help someone you care, please share. Leading self and others.